Hello and welcome to McLaren Port Huron Today's Health Program. I'm speaking with Dr. Zubin Bhesania, a board-certified general surgeon, about hernias. Dr. Bhesania, thanks so much for joining us today.
Thanks for having me again.
So tell us about a hernia, just kind of the definition and describe them for us.
So a hernia basically means a hole in the abdominal wall, and within that hole we'll have something travel through the hole to fill up the space there. So it could be a piece of bowel, it could be a piece of fat. So simply put, it's a hole with some sort of structure within the hole that doesn't belong there.
And what are some of the common types of hernias?
So we can see hernias anywhere, but the main hernias that we see are inguinal or groin hernias, we have umbilical hernias, we have incisional or ventral hernias. So umbilical hernia means there's a hole at the belly button. A groin hernia means there's a hole at the groin, and an incisional hernia means there's a hole within the incision.
So let's start with the inguinal hernia. So what is the cause of that?
So inguinal hernias are very, very common, and it can happen both men and women. It's much more common in men. And typically you can either be born with a hernia, so it's a congenital defect, because what happens in utero is the testicle actually develops up by the kidney, and then during development will travel into the scrotum and has to travel through the abdominal wall. So there's a potential space there. That space usually closes when an infant's born, but sometimes it remains open, and that's a congenital hernia. Also, as people get older and just with work and strain in that area, you can develop a hernia at the groin, and in men it's much more common than women. But once again, there's a hole that develops, and then we can have a piece of bowel or a piece of fat travel within that hole and get stuck in the hernia.
What kind of symptoms would people experience?
So the most common one is first they'll see something. So they'll visually see a bump that's new, okay? And the bump can be at your groin, it could be at your belly button, it could be on the abdominal wall. So the visualization of a new lump or bump is a sign there could be a hernia. If that progresses, they'll actually feel a piece of tissue within the hernia. They may feel bowel within the hernia. And then later on, a much more serious complication would be abdominal pain or a bowel obstruction related to a hernia.
And how is it diagnosed?
So it can be diagnosed clinically. So we will see people in the office that have a complaint of an abdominal wall mass or a groin mass, and we'll do an exam to check them for a hernia. When we examine the belly button, for example, we will have you strain, lift your legs, and look and see if that mass increases in size. We can try to push on the mass, see if we can reduce that mass, and sometimes you can actually feel the hole in the abdominal wall at the umbilical hernia. In the groin, we do the same thing where we check people for hernias. In men, we'll actually place a finger up along the canal that the testicle travels in, and we'll have them cough, and we can actually feel the hernia come down and touch our finger when we examine them. There's also certain x-ray tests that can be formed to look for hernias. A CAT scan is a very common test, and we can actually see the hernias on CAT scan when we do these images.
And does a inguinal hernia pose any health risks?
So a hernia has a potential for a health risk, okay? So we have the issues with, obviously the visual part of having a mass or some straining and creating a mass that comes and goes. But the real health problem occurs when something gets stuck within a hernia and it swells, the blood supply to whatever's there can be compromised, and that can cause a real problem. So when a hernia is incarcerated, that means something is stuck within the hernia. When a hernia is strangulated, that means the blood supply is cut off, and that can be a very serious problem. Sometimes we'll have bowel obstructions related to hernias because a piece of small bowel will get stuck in the hernia, and the bowel is like a garden hose. If you kink it, it'll be obstructed, and that'll cause problems. So it potentially cause some very serious health problems. Also, if you leave a hernia, it tends to get bigger over time. And so people that have symptomatic hernias really should have them fixed before they get bigger.
And so let's talk about some of the treatment options.
Well, it's changed over time. So 25 years ago, we used to make an incision to fix hernias. So wherever the hernia was at, we would make an incision. So if you had a hernia at your groin, you'd have like a 4 or 5 inch incision at your groin. If you had an umbilical hernia, we'd do an incision at the umbilicus. If you had a ventral or abdominal wall hernia, we would have to make a scar over the hernia. But times have changed, and we now use a device called the Da Vinci robot to do a lot of hernia surgery. So most hernia surgeries today are done laparoscopically, typically with 3 little incisions, and we're able to use the robot to help visualize the hernia and repair the hernia. So what we typically do is visualize the hernia, so it's basically a hole. We will suture the hernia laparoscopically, and then we have a special onlay patch that goes on top of that repair typically.
And really, this all this switch to doing this robot-assisted surgery is to help reduce risks for patients as well?
Well, it reduces risk, and it also reduces the downtime. So people who have a groin or umbilical hernia are much sooner to get back to their normal activity versus the old-fashioned technique. So when we did the open hernia repairs, it would be 4 to 6 weeks of doing no heavy lifting, no straining, nothing. And with the advent of laparoscopic hernia repair, people are getting back to work much, much sooner and back to their normal activities much sooner with less pain.
So the anticipated recovery probably really depends on what type of hernia you're repairing.
Correct. So it depends on the type of hernia you're repairing, the patient's overall condition, whether it's a recurrent hernia, all play in a role into when they're getting back to work. But typically, we do it laparoscopically, you're recovering much, much faster.
Yeah, this has been really great information for our audience. Do you have any closing comments?
Well, thanks for having me here again. But you really should get checked if you see a new lump or bump that wasn't there before, or if you're feeling pain in an area, really get checked by your doctor.
And thank you for watching McLaren Port here on today's health program. If you found this video helpful, please be sure to like it and share it on your social channels. You can check out the entire video library at www.mclaren.org/phvideo. And thank you for watching McLaren Port Huron Today's Health program. If you found this